Good afternoon, everyone. The webinar will start in 5 minutes. Hey, good afternoon, everyone. Welcome to the webinar. We've got about 1 minute before we start, but we have Reagan as producer. She's going to be monitoring questions and everything. We're going to try, we have a lot of content. We're going to try to hold this to 1 hour. I think you'll find it very informative and also kind of a good news story in the healthcare arena this year. So we're very excited to be on this. For those of you on the webinar that will be attending either the Community Bankers Association of Oklahoma or the Independent Bankers Association of Texas annual conventions, Advantage Health Plans Trust will be at both of those. So we look forward to seeing you all along with the Kempton team of Kanda Ramos and Merrick Matthews and Todd Rogers and myself. So I'm showing 2 o'clock and we've got a load of information to go through. So we're going to go ahead and begin. So moving on to our agenda, we're going to go through introductions, performance and reporting, prescription performance, RX performance, the 2024 renewal and the methodology behind that. Also an overview of the renewal and any changes for 2024. Also talk a little bit about the 2024 benefits through Advantage Health Plans Trust, compliance, account management and education, and then finally the open enrollment timeline. Go through some of our speakers. I think most of you all know me. I'm Jay Kempton. I'm the president and CEO here at the Kempton Company, and I'm also honored to be chosen by the Advantage Health Plans Board of Trustees as the program manager of Advantage Health Plans Trust. I also have two other speakers that are joining me today. We're so proud of these two partners that we have, and I'll just let you all know because we're all kind of family here that going through the renewal process is it's always kind of a hairy situation this time of year. Lots of time compression that goes on because we want to try to get as much data as we can to give the actuaries and the underwriters the best picture of what Advantage Health Plans is going to be looking like for the next year. Yet we also want to be able to provide the member banks with renewal information as quickly as possible. Because of that, the timelines get compressed, and my staff, the Kempton staff, and then along with the actuary and the underwriter, which our actuary is Paul Facili from Windsor Strategy Partners, and then also Vicki Schmelzer from Strategic Underwriting Solutions. We work very closely as a team, really under really tight timelines, so we get to know each other really well this time of the year, and they're going to be joining me on the webinar a little bit later. However, most importantly, I want to introduce the Advantage Health Plans Trust Board of Trustees. These trustees are elected by you, the member bank and employers of Advantage Health Plans Trust. The trustees run the program. The Kempton Group, we work for these trustees on a contract basis. So really, these folks are our boss, and you are their boss. So start with the chairperson, Priscilla Cude from First Bank in Bethany, First Bethany Bank and Trust here in Bethany, Oklahoma. We also have Scott Long as vice chair. Scott is from First National Bank of Sterling City in Sterling City, Texas. We also have Jim Dilley from American Heritage Bank in Sapulpa, Oklahoma. Sandy Werner from First National Bank of Elk City. Casey Barrett from Texas State Bank in San Angelo, Texas. Joey Root from First Liberty Bank of Oklahoma City. And then Evans McBride from First National Bank of McAllister. Evans is new to the board this year. He has been an advisory trustee for a while and now is in the chair. So welcome, Evans. Also, Doug Fuller is an advisory trustee from Quail Creek Bank in Oklahoma City. Lane Brandt is one of our new advisory trustees from Crossroads Bank in Yoakum, Texas. That's a fine community. I was there a couple of weeks ago. It was good to see you there, Lane, in the bank. And then also John Gorton is a new advisory trustee from First National Bank and Trust of Chickasha here in Oklahoma. Thank you to the board for all of your service and the time that you devote to this program. Now, performance and reporting. We're going to go through this rather quickly. There is much more detail regarding performance and reporting that will be coming out in the annual user group packet, which you will get after the webinar. We have strategically done that because we want you to pay attention to the webinar as opposed to say, oh, we've got the packet and go off and go about your business. We want you to pay attention. We feel like we do have some important things to say, but if you want more detail, they will be provided in a packet, and this webinar will be recorded. So you will be getting that packet along with all the detailed management reports, along with the recording for this webinar. Some of the most important things is really where have our claims been over the last several years from a medical and a prescription perspective. You can see from 2016 through the first 6 months of 2023 what the health plan claims have done and what prescriptions have done. Health plan claims, we certainly saw that that peak, if you will, in late 2019 and early 2020. Those were the COVID-related spikes, kind of carried on into 2021. And then we started seeing a real turn in the experience in the number of claims and the magnitude really coming down in 2022 and so far in 2023. We hope this trend continues. Claims versus contribution. That would really, if this was an insurance plan with an insurance company, we would call this claims versus premium. But since this is not an insurance company and this is simply a self-insured trust, we call them contributions. But you can see back from 2016 to the first 6 months of 2023, what claims, all medical and administrative expenses have done versus the dollars coming in from the member banks, annual contributions. You can see in 2016, we generated some surplus. Along in 2017, 2018, the surplus started to come down. 2019, we had a loss year as a trust, as did we in 2020 and in 2021. 2022 and 2023 have turned around. So that this is a good perspective of essentially premiums or contributions versus expenses. Total net assets available for benefits. This is the total cash that your trust holds. This would be out of the account that we actually process claims out of, plus what we call the reserved asset account, which is likened. I have been many of trustees who say, well, that's just like the bank's capital. Between the two, the reserved assets and the unreserved assets, this is a total. And you can see where the net assets available for benefits have been since 2016. And in relation to the reserves, the minimum reserve requirements required by the state of Oklahoma, Texas, and New Mexico. They all use the same standard for that. And that reserves required by law is calculated based on, it is 20% of annualized contributions is what you need to be to keep in reserve, to keep in the good graces of the insurance commissioners that we must report to. You see things got a little thin in 2021, and that, of course, we also had that mid-year contribution increase, and that's a good illustration of why. But the trust has really come back. I can report to you, it's not on the slide here, but I can report to you that as of today, as of September, mid-September, the net assets available for benefits is over $14 million. So things have turned around really, really well, and the trust is generating good surplus. Talk a little bit about some of the new direct contracted providers. Direct contracting on behalf of your trust has been an integral part of our overall strategy to maintain costs really since 2012. It continues to expand, and also the results of that expansion and more utilization from our member banks and your participants is driving a lot of these positive results that I just looked at. We have 30 new Kempton Premier providers. These are providers that do the legwork to negotiate a upfront bundled cash price for your medical care. Because that price is so good and it is known prior to the patient ever stepping foot into that medical facility, we are able to share the savings with the members in real time by waiving deductibles, copays, and co-insurance. We've got 30 more of those. It's hard to believe that back in 2011, late 2011, it started with one. So we're close to 800 now. So we're very, very proud of the success. It's really blossomed nationwide. We're just showing you Oklahoma and Texas, but this movement has really spread very aggressively around the country. Kempton Direct Access Providers, the direct primary care providers, that we have 24 new of those in 2023, and then 10 new medical providers that we have direct Medicare plus style contracts where the plan pays those providers at a percentage above the medical provider's Medicare reimbursement. The beauty of that is there's no balance billing risk to the members, and the pricing is generally much better than what we would see through a commercial network discount arrangement. So that continues to grow as well. This is a busy slide, and so I'm not going to step all the way through it. You all can read. We've seen these slides before, but really this is comparing 2022 and 2023 missed opportunities for Kempton Premier Provider utilization. So this is going to be a situation in which a participant has a medical need that could have been done at a bundled cash provider, a Kempton Premier provider, but for whatever reason, maybe it was an emergency, maybe it was just a convenience thing, it couldn't be done, or the participant just didn't want to do it. But I do feel it's important for me to show the delta between what was actually spent versus what could have been spent if we had utilized more of a market-based medical provider with market-based pricing. And you can see so far through 6/30 of 2023, about $490,000 worth of missed savings, with the largest single medical procedure that could have been done with a premier provider that wasn't done ended up costing the trust about $38,000 more than it needed to. That is way down from the 2022 missed opportunities, where we had one surgery that we paid $114,000 more than we needed to. And of course, the patient had to meet their deductible and co-insurance, which was not necessarily needed either. This is not a judgment. This is really just more of a financial reporting of the delta, that the savings that is available out there. Okay, Kempton Direct Access Providers. This is for the direct primary care benefit that is built into every single bank's plan. Every plan under Advantage Health Plans, with the exception of the qualified high deductible health plans, all except the qualified high deductible health plans have a built-in direct primary care benefit where the participant can voluntarily choose, if they wish, to sign up for a direct primary care membership, and the health plan will pay for that direct primary care membership at no cost to the participant. This is starting to grow. It hasn't had nearly as much a long enough run like Kempton Premier Providers, and quite frankly, there are not that many direct primary care providers nationally. There are a lot, but in the great scheme of things, you won't find one on every corner. So we're going to continue to monitor this. We do play requests. And so if you do find a direct primary care medical provider that is in your community that we do not have on the Kempton Direct Access Provider list, which is on the Advantage Health Plans Trust website, please give us a call, send us an email, and we will approach that direct primary care provider. Real quickly, Visa Health is a program that we implemented beginning of 2022. This is a group of fantastic nurses that assist some of our more chronically ill participants in chronic disease management and also remote second opinions. There is a tremendous number of patients all across the country in the healthcare space that are misdiagnosed every single year. So this is also a free benefit to the members of Advantage Health Plans Trust, that if you ever just want to talk to a nurse about the care that you're being provided, maybe you have questions about how things are going, or maybe you're concerned that you're not getting the results or the relief that you thought you were going to at your current medical provider. If we need to send you for a remote second opinion to, say, the Cleveland Clinic, we can certainly arrange that, and it is no cost to the member, no cost to the patient. The health plan pays for all of that. We've had 7 touch points so far in 2023. We're going to be doing some things in 2024 that I think is going to really ramp that utilization up quite a bit. We're going to be integrating Visa more closely with our case management and utilization review solution. So more to be said about Visa in the coming weeks and months. Prescriptions. Medical claims are obviously they're increasing, but they are never increasing as rapidly as the cost around prescriptions. And so Advantage Health Plans employs 3 distinct cost containment programs to help manage RX costs. Not just the drugs that are purchased at retail at your local pharmacy, but also for the high dollar specialty meds that generally come via a mail order house or a specialty pharmacy. The first one of those programs is Southern Scripts. They're now known as Livinity. They did not get purchased. They just went through a rebranding. You can kind of see the rebates through 2022 and 2023 that we were able to receive through our relationship with Livinity. You can also see the clinical utilization management savings of almost $500,000. That's simply making sure that participants are taking the most economical yet effective drug possible at the time. Obviously, encouraging generic utilization is very important to that as well. I've also listed, there's a lot more pharmacy information that's going to be in your packet, but I just wanted to draw your attention to also the top drug by therapeutic class for 2022 and 2023 Q1 and Q2. Advantage Health Plan spends as a class more on anti-diabetics than any other drug class. Second is analgesics and anti-inflammatories, and number 3 is dermatologics, followed by anticoagulants, et cetera, you can see. I thought that the bankers would find that interesting as far as what is driving the cost as far as a therapy class goes. The second program that we use to manage the RX cost is script sourcing. This is where when a high dollar specialty drug is identified, we work very, very hard with the patient and the referring physician to try to get those drugs sourced either internationally at a tier 1 country, which would be usually it's Canada, Australia, New Zealand, or the UK. If we can get those sourced at a lower price point, they're the exact same drug from the exact same manufacturer, but many times they can be sourced at a fraction of the cost. We try to do that. The other thing that script sourcing assists us with is also taking advantage of any manufacturer's assistance programs. When those can be employed, it can result in no cost to the plan and no cost to the participant. There are some income guidelines that the participant has to meet in order, and it's for particular drugs and for particular folks that have a family income under the manufacturer's threshold. Script sourcing assists us with that, and the trust has saved about $1.1 million since December of 2021 on this program. Script sourcing has done an incredible job for us, and so I want to hats off to script sourcing. The last one is Scripta. Scripta is really a tool that helps patients make better choices as far as buying generic drugs whenever possible, possibly buying lower cost name brand drugs. I know that they have influenced me to be able to steer me to lower cost yet equally effective drugs that I didn't even know about. My pharmacy didn't tell me about it, but Scripta did through their Purple Dot savings reports that I get via text. So far in 2023, we've had 481 members that have made a voluntary switch to a lower cost drug that we've realized about $127,000 worth of savings simply by participants choosing a lower cost and equally effective drug. The results. I know you bankers are numbers driven and results driven. This is the average prescription cost per employee. You can see going back to January of 2021, you might ask, why in the world did it become so sawtooth at the end of 2021? That is script sourcing. They bill in batches as opposed to a bi-monthly cycle like Southern Scripts does. And so once we started sourcing a lot of our drugs internationally, or really internationally, We got those bills in batches, and that's what explains kind of the sawtooth there. But the green line is what we're all excited about, and that is as close to flat, if not slightly declining. Having a negative RX spend trend line in this day and age is almost unheard of. And so this is taking a lot of work, not just from the Kempton staff and the trustees, but you, the bankers and your participants. This does require more work, but the results, I think, speak for themselves. Most benefit plans out there are seeing prescription drug costs going up by 9, 10, 12% per year. We're managing it to be relatively flat, so we're going to continue to do that for as long as we possibly can. Okay, at this point in the presentation, I'm going to pass this on. I don't know how in the world I got through 20 slides in 21 minutes, but I'm gonna take it. So at this point, we're going to turn things over to Paul at Windsor Strategy Partners, and then also Vicki at Strategic Underwriting Solutions, to talk about the Advantage Health Plan's renewal. So with that, I'm going to stop talking. And Paul, Vicki, are you on?
We are. Here we are. Thank you.
We can hear you.
Paul had another conflict, so I'm sitting in for Paul today.
Okay, well, David, we welcome.
Thank you.
And my webcam is being a little finicky, but I am here. I'm not certain if you can see me and when it's going to kick in, but it should be soon.
Sounds good. Well, David, why don't you just take us away?
Sure thing. Do I have control of the presentation?
You just tell me when to advance the slides and I'll do that.
Okay, sounds good. Can you go to the next slide, please?
You bet.
All right, so as actuaries, what Paul and I did, we took a look at the last 12 to 24 months of experience, kind of projected that forward to where we thought the plan was going to be at the midpoint or end of 2024. So we're taking a macro view. What does the overall increase need to look like to remain in a good place, according to what Paul and I would consider a good place? If you go to the next slide. And what we do with this exercise is we look at 3 different components or buckets. First, the medical and RX claims, which makes up the largest bucket, which is a good thing. Administration expenses, about 21% of the cost, and then the stop loss portion. Next slide, please. So factoring all of these expenses in, we take a look at the last 12 months of experience, put our assumptions in, which is usually trend and large claims, economy, those types of assumptions, and figure out where we think the plan's going to be next year, and then what increase to the contributions we need to get to that ultimate expense total. And as you see, we are looking at a 3.27% increase from last year. And that's factoring in a medical trend of 7%. RX would be at 9%. Administration is a 3.5% increase. And as a note, administration expenses, it's not just what Kempton is collecting, but it's what you're paying us, the actuaries, underwriters, legal fees, everything that makes up what it takes to run the plan other than stop loss and paying claims. And then stop loss at a 10% increase. So you're sitting at contributions this year of about $1,090 per employee per month. And we're looking at, again, 3.27% increase to get to about $1,125 PEPM. Next slide, please. So we work on a few different MIWA programs, and this increase is by far the best we've seen. Last year, the same program AHPT was 6.55%. This year, it's about half of that at 3.27%. It reflects just the good experience we've seen over the past 18 to 24 months. It's about as aggressive an increase as I've seen, and it's aggressive in a good way, where we're getting lean. You know, we've built up surplus, we've added to the reserve, so we feel comfortable rewarding the trust by giving this a pretty generous but warranted increase. And again, the blue ribbon, because it's the best we've seen. Just this year, other programs are closer to the 10% increase, I would say, if not higher. So it just reflects the good experience that we've seen so far. Next slide, please. Just real quick on dental, we're not giving it any increase. It does not that much to the overall medical or RX claims, about 3.5% of contributions. So we kind of, within that 3.27% increase, we considered a little bit of the dental going towards, or I guess a little bit of that increase going towards the dental. So we're just keeping it flat for next year. Next slide. So again, once we figure out that we need a 3.27% increase, we tell SUS, the underwriters, and they work their magic, and we say 3.27% overall. However, you allocate that per group is the micro, I would say, the micro level, and that's what they're going to discuss. Next slide, please. Real quick on the margin, we added a 1.5% margin to the medical RX trend, just in case some of our assumptions are wrong. We want to have some cushion in there for adverse deviation. For some unforeseen events, such as COVID or a severe flu season, RSV is, I know, kind of last year was surging, so we kind of expect that might come back again. We're using different assumptions and just to make sure that we feel comfortable that we're adding a little bit to make sure that we're on the right side of where we think things are going to go. And just for reference, 1.5% for margin is pretty low. I like to see it in the 2.5% to 5% range. 5% is high. I think last year we're at 3%, and that's usually where a lot of the programs are. So at 1.5%, it's pretty low. So we've, again, just reflecting the good experience that we've seen from the program. Next slide. And in case anybody was wondering why there's actually an increase if the plan is running really well, it's just medical trend overall is still alive and well, as the slide says. General economy, you see inflation is still pretty high. Mental health parity is a hot topic right now, so their plans are having to pay more towards the mental health services, so that's increasing costs. Specialty drugs are always coming to market. They're expensive. New cell and gene therapies are coming as well, and those are incredibly expensive. And we've just seen an uptick in just high cost claims. So we want to make sure that we've got our bases covered. Now I ask if there's any questions. Anything?
It does not look like we have got any questions right now. So Vicki, you are up, I believe.
All right.
Thanks,
Sounds
David.
great.
Thank you.
All right, hello everyone. Great to be here with you all. And I'm Vicki Schmelzer, and we are your underwriters for the trust. I'll tell you a little bit more about what we do once the actuaries project the required increase for the trust. First, congratulations again. You all created a wonderful renewal for yourselves. It's your trust, your plan, and you've done a great job getting the treatment you needed at the right cost. And as Jay said, congrats on driving down that trend on the RX. That's a big deal. So certainly not many, if any, are doing that in the market. So again, congratulations. All right, Reagan, if you can take it away, go to the next. So the methodology that we utilize when we're preparing the renewal is we look at what is the goal, first of all, and the goal is that we want to retain the highest volume of the member groups, all of you at the most reasonable rate, and just to maintain the required and appropriate reserves. So Paul and the team came up with that black increase. At the same time, we have a whole team of underwriters, several of them here in the office, that are looking at the detailed information for claims and projected risk to make sure that we, again, keep everything in an appropriate category for risk going forward. So that's all going on at the same time. The actuaries are working, so is your team of underwriters. All right, Reagan? So as we talked about, they look at the trends as David explained and go forward. We look at, okay, so what is the least amount of risk within some of the groups versus the contributions made to the trust versus those that might have a little bit more higher risk in the group and their contributions to the trust. So we go through that whole mix and evaluate on a per cases, per member basis. All right, kind of short and sweet, but a whole lot of detail that happens in the meantime and before the renewals are presented to you. Okay, Reagan?
Right in the thick of that, and Vicki is absolutely right. It is it's a lot that goes into this. The level of analysis that Vicki and her team do it's really exceptional, and it takes a lot for us to really kind of digest it and look at it. And so that's why it's going to probably be another week or so. But you can rest assured that when Vicki and her team are finished with this, then it is definitely going to be something that is fair, equitable, and in the best interest of all of the member banks.
Right, thank you, Jane. And so again, as we shared, the overall is a 3.27%. Your individual group increases will be released in the coming weeks. But if you look at the next slide, Reagan, you'll see that you're in a really great spot. And these are some of the facts to share with you, how great you've done by being a part of the trust, helping each other as member banks in your industry, which is wonderful. So it's 3.27 and it's so favorable. Just to help put it in perspective, when you're not working in it every day, such as we are, sometimes, it's a little bit easy to lose that perspective, but the average increase in America is 9% with the cost of inflation and just professional services. And this is from top, national actuarial firms too that look at data analysis and trends. Professional services alone are projected to increase 9%. So imagine how favorable it is to have a 3.27. Then if you look at what's happening in the fully insured market, not being part of a self-funded member trust, well, those groups in the small group exchange for Oklahoma are getting an average rate increase of 9% at this time. Those in Texas, looking at the information available with what these large carriers have filed for, so Blue Cross Blue Shield, United Healthcare, Cigna, and Aetna, some of the biggest players in the market, thank gosh, you outperformed all of them. They're coming at an average of 5.95%, and the state of Texas, you're at a 3.27%. So great job to you and all of the team at Kempton for keeping costs in line. So with all of that, you know, what we can tell you is already with the work that's been done, it's appearing that we'll be able to have about 85% of you member banks will be receiving about 5% or lower increase. Again, we're going to be finalizing that whole stratification and the exact increase for your group in the next few weeks. But overall, just congrats on a great year. And that's a level of detail that we look at and bring to the picture for the trust. All right. Any questions there? I know that's a whole lot of technical lingo, but I hope it's helpful for you to see what we contribute and how you contributed to your own success of the trust.
There are no questions so far, so I think we're good.
Thank you, Reagan. I was looking at the same thing. So we're going to mush forward. Vicki, David, I'm not sure if y'all can hang around, but there may be questions at the end.
Sure.
We've got about 25 minutes to go, so we'll get trucking here. So again, overall renewal overview, as Vicki and David said, overall trust level increase. So at the going forward into 2024, the actuaries have determined that we need to collect 3.27% additional contributions to be able to pay current and future obligations without eating into the reserve. And so, and then the individual bank by bank adjustments will be delivered. Our goal is going to be at no later than October 2nd of 2023. So we'll got a little problem with the slide there, but we'll fix that on the packet. Okay, just as a quick review, medical plan increase trend from 2017 to 2024 for Advantage Health Plans Trust average over those 8 years is 5.37%. You can kind of see, I won't read those to you, but 5.3, the trustees' goal, what they tell us is they want to be at or below trend. And you can see that some years we hit it, and sometimes we're significantly under medical trend or medical inflation rate. Sometimes we're at, sometimes we're a little above, but overall of 5.37 over 8 years is pretty good. I don't know what the average trend would be over the same time period, but that is a pretty good number. Some of the decisions that were made by your board in 2024, just again, there's a lot more detail in this in your member packet, but they have decided to start to sundown the Select 500 plan. We have very few member banks that offer it as part of their plan. And if you are currently offering a Select 500 plan design, you can keep it. But we will not be allowing any new enrollment into the Select 500 plan. That's one that we felt pretty strongly, along with the actuary, that we haven't seen new enrollment on that plan in a long time. It's just probably time to retire it. For the Oklahoma banks, I think this will be welcome news. We are going to be offering a new Insure Oklahoma compatible plan design for 2024. It will be based on the Select 1500 plan design. Insure Oklahoma is an employer subsidy program that we have here in Oklahoma. They are very stringent on what the plan can look like in order to be qualified. So right now, Select 1500 does qualify. We will consider new plan designs if there is enough demand for that, but that's great news. Also, we will be enhancing the case management and utilization review program within Advantage Health Plans with a new vendor known as Fiduciary Health Solutions. That will be effective January 1. Our old vendor for case management and utilization review, and they've been our solution for over a decade, was Medcom Care Management. Well, they have recently been purchased by another organization called Health Comp out of California. we have seen a marked decrease in responsiveness and really just service levels. So we have reported that to the board. They wanted us to look at other options, and we did find a new option that we feel very comfortable with, which is Fiduciary Health Solutions. If you are a healthy person that doesn't have a lot of medical claims, you probably don't even know what I'm talking about, and that's great. But for those of us that have chronic conditions or are heavier utilizers, you very well may have talked to a Medcom nurse. In the future, you will be talking to a Fiduciary Health Solutions nurse. They are on the same team with Visa Health, which I spoke about earlier. A couple of other really kind of housekeeping changes are minimum value plans, or MVP plans. Those will be modified in January to match the maximum Affordable Care Act federal out-of-pocket maximums. Those get updated every year as the feds change the maximum. Those plan designs are indexed to whatever the Affordable Care Act maximum is. So that's an update. Same with the change for the high deductible health plan, HDHP 2500 plan. Its embedded deductible will also be modified under the new federal minimum guidelines. The details on that will be in your packet. I actually think I have a slide on it. This will be, the last bullet is something that I think will be of great importance to a lot of us. The GLP-1 drug class, otherwise known as the Wegovy's and the Mounjaros and the Ozempics of the world. I can tell you that this has been a topic that the board has been talking about all year long. That class of drugs is covered right now currently for those participants with a diagnosis of type 2 diabetes. However, those drugs also have an indication for weight loss. Advanced Health Plans does pay for weight loss surgeries under a fairly strict clinical guidelines. The board wanted to do something similar on these new weight loss drugs. I don't want the takeaway to be that Advanced Health Plans now pays for weight loss drugs. This is going to be, I think, on the bullet there, they are now available through a managed clinical pathway. So we're talking about folks that really could benefit from these drugs, not that you have a wedding to go to next spring. So there's a lot more detail in your packet in regards to that, but that is going to be effective for 10/1 of 2023, so just next month. But like I said, not everybody on the plan is going to qualify for that because they've got a few pounds to lose. This is only going to be, at least at this point, for the folks that have many comorbidities and have a lot of weight to lose. Okay. Ancillary products that are available under Advanced Health Plans Trust: the dental plan, the vision plan through VSP, Unum Voluntary Life, and Unum Long-Term Disability, and then Leaders Life, Term Life and Accident. No changes to any of those ancillary benefit plans. Those will have no rate increase going forward into next year. The 2024 benefit changes is really kind of a summary. Those are the changes to the minimum value plans. I think we have maybe 1 or 2 banks that even offer a minimum value plan, but if you're one of them, these are the new changes that are going to result. Also, the qualified high deductible health plans, the HDHP plan designs, these are the new minimum embedded deductibles that are being updated from $3,000 to $3,200 to match the new ACA, Affordable Care Act, minimum deductibles. Lastly, in this area, this is a slide for Fiduciary Health Solutions. This is the replacement for the Medcom case management and utilization review. These are just some of their services. Again, you'll hear more about them in the coming weeks and months. This is going to be something that will impact folks that are expectant mothers, folks with chronic disease states that might need some assistance. Also, folks that are inpatient in the hospital, et cetera. You are very likely either to be contacted by Fiduciary Health Services or you can always reach out or be referred by a Kempton Care Advocate for any of their services that you may require. As we start to move into the end of the presentation, we've got a few summary slides and a few other housekeeping items. This is just a reminder slide for KPP Free or Kempton Premier providers. It's as easy as 1, 2, free. Those are some of the things that HR folks would really need to remember when they have questions that come from participants on, hey, how do I, what's my next step? I've heard about this this free surgical benefit, free testing and imaging benefit. These are kind of the steps. KPP Free also has an app. I'm not sure how many bankers are using this, but we wanted to remind you of this. It is available in the Android store and also the Apple iStore. It's simply called KPP Free, and it is a medical related app in the medical section of those stores. It is free. You can initiate a KPP Free interaction with one of our care advocates through the app. You can also search for KPP providers and procedures. You can do it by procedure code, by natural language, by location, etc. You can see upcoming appointments. You can receive your voucher also on the app. Those are the instructions on that. Quick reminder, Kempton Direct Access Providers, which is the Advantage Health Plans provided direct primary care benefit. This is, I'm not going to read the slide here. Really, if your bank is interested in this, which if you're not, you should be, we would love to get a call or an email into one of our account managers for Advantage, either Shannon or Jolie, and we can either come out and see you or schedule an employee meeting or a Teams meeting to talk more about how your bank can start to utilize the services of a direct primary care relationship with a local physician. Compliance, everybody's favorite topic. The main area of compliance that comes around this time of year every year is the 1094, 1095 play or pay calculations that the Affordable Care Act requires. There are really two options to comply. Every employer does have to comply with this. You can either choose to use Kempton to assist you with that. It is a separate engagement that is outside of Advantage Health Plans Trust. It's with one of my sister companies, Kempton Group Administrators. We do charge, the rates are right there. If you have your own compliance vendor for pay or play, you don't have to use us, but you will need data from us, and we supply a current census format or standard census format, which you will need to provide to your vendor. We provide that at no charge. If your vendor is not able to use our standard layout that we've used for many, many years, we do have an hourly rate for custom programming for a custom census. Those usually don't take more than an hour if they're even necessary. But to move to the next steps on either one of those options, you can send an email to Gary Plunkett. He is our CFO, gplunkett@kemptongroup.com. Account management and account management and education. We have changed our, there have been several email blasts on this, but we have changed the really the account management structure for Advantage Health Plans last year, really at the end of 2022. We've really moved. We still have reps that come out and see you. You may have seen Todd Rogers or Merrick Matthews. But as far as somebody coming around and checking on the banks, banks are, those are normally required by appointment only these days. It's very difficult for the kind of the pop in like we used to do for years. Banks don't appreciate that. And so what we've done is we have two dedicated inside Kempton account managers. They're Shannon Kerr. Is the primary account manager. She's also the vice president of client success here at the Kempton Group. She has been with our company since 1976. She darn near raised me in this business, but we worked together very, very closely. I've worked with Shannon for 32 years, and she has forgotten more about advanced health plans than probably most of us ever will know. You can reach out to Shannon or Jolie anytime, again, to field questions. They will also be calling your bank. We try to go through and have at least 4 touch points, 1 touch point a quarter, where we're making an outbound call generally to the HR contact within the bank from Jolie and or Shannon. If you ever want an employee meeting or somebody to come see you, you just let Shannon or Jolie know that, and then we will then make an appointment and come out to the bank. There is Shannon's direct dial information. Jolie Bowman is really kind of a, banks are always working on succession planning and everything. Jolie is really kind of that heir apparent to the Advanced Health Plans account management position. She's really your secondary point of contact for day-to-day questions and concerns that may arise. If you're looking for kind of a friend at the factory, Jolie and or Shannon will be that dedicated point of contact. I really recommend that each and every one of you reach out to Jolie or Shannon, or wait for them to reach out to you. But we really have a vision that we will have some close and deep relationships between our member banks and these two ladies. They are exquisite professionals in the benefit space. Kempton Academy. We have had several member banks that have requested through the years, do you all have like an instructional video or some sort of something that I can just push out to new employees, or if employees have questions, I can say, hey, just listen to this, as opposed to necessarily scheduling an employee meeting. If you want an employee meeting, we would love to schedule one, but it's actually one of our agenda items. But if you would rather just have a video, we went through quite a bit of effort to have a professional production company. It's not me or Shannon or Merrick or Todd doing this. We actually have a professional production company create a video series on what it means to be self-insured. What does it mean to be a good healthcare consumer? How do you use Kempton Premier Providers? What does reference-based pricing mean? All of that can be accessed through this video series that we call Kempton Academy. It is on YouTube. It is a private link, so you can't just search it on your YouTube browser, but we've created this QR code. If anybody wants to, and you're going to get a copy of these slides, but if you will scan that QR code, it will take you to that hidden link. You can then bookmark that link, share that link amongst the bank, post that link on the bank's intranet. They are available at no cost and unlimited use. The only reason that they're a hidden link is simply because we don't want the general public accessing this, and besides that, it would probably be not quite as relevant. So that's Kempton Academy. Advanced Health Plans open enrollment. This is the 2024 timeline. October 2nd, no later than October 2nd, we will have the individual bank level renewals that will be delivered. By October 15th, open enrollment begins. By November 1st, all plan changes are due back into the Kempton Company. October 15th through November 30th, we host open enrollment meetings. We spend a lot of time on the road, and we love being out there in your banks. November 15th, we will have updated plan adoption agreements and benefit selectors. Really, those are essentially the annual, AHP doesn't have a contract, but we do have a subscription agreement that we do like to get updated, along with if the bank is going to be making any changes to the plans that they offer within the bank. Those decisions are collected through a new document that we will be sharing with you. There, it is known as a benefit selector. Those are due by November 15th. By December 1, final eligibility and open enrollment changes are due into the Kempton Group. That way we make sure that we get ID cards, new member packets, etc., delivered and in the hands of the bankers prior to January 1. If we're not able to get those enrollments in by December 1, it really puts a stress on being able to make sure that we have everything set up appropriately for your bank and new ID cards and new materials out to the individual participants by that all important January 1 date. I don't expect any sympathy, but at least I'm sure the bankers can probably relate. We are going through a core change here at Kimpton. We have been on the same core. We don't call it a core system in the benefits world. We call it a claims adjudication platform, but I know if I say core, you will understand the magnitude of this change. I know many banks that go through it, and I try to describe to my friends, well, why is this so stressful to you, Jay? I said, well, I'm going to use a juggler analogy. It's like throwing every ball you have in the air, trying to juggle them without dropping one. So we've been in the process of changing from GBAS, which is our old claim system, stood for Group Benefits Administration System, to a brand new cloud-based, really state-of-the-art claim system called Virtual Benefits Administrator, VBA for short. We've been transitioning other clients, non-bank clients, non-advanced health plans clients. We've been transitioning groups to VBA since May of this year. We're doing it on every client's renewal date. Advantage Health Plans Trust renewal date, as you all know, is January 1. So Advantage Health Plans will be migrating from our legacy claim system to our new claim system effective January 1. Again, we are going to try to make that as seamless as possible. There are a lot of benefits to this change. Just a few of them that you will see will be a brand new web portal that is going to be phenomenal, much highly upgraded, lot more functionality than it had before, along with a brand new mobile app that is also light years ahead of our old mobile app. Those two go together with the switch to VBA. Because of that, everybody will be getting new hospital ID cards that you keep in your wallet, you give to the medical provider. It is going to be imperative that every single participant, spouse, dependent that is on the plan destroys their old member ID card and uses the new member ID card. If you don't, there's two key things that are on that ID card that if you use the old one, it will cause your claim to not get filed appropriately. It'll be a problem. The two changes, first off, is the member ID that becomes part of your bill that comes from the medical providers to us. That number is changing because of the system change. So if they use the old member ID, it can cause that claim to be misrouted or just to go nowhere. So for January, when we have our new ID cards in everybody's hand, and the first time we go to the doctor and that intake clerk asks that all important question, I need your member ID and your insurance card, and oh, by the way, has anything changed? The answer is yes. I have a new card and it has new information on it. Please update your system with the new information that's on my card. We really need everybody to do that to ensure that there's no disruption. The other positive thing about the new member ID cards that everybody's going to have is there will be a new phone number to be able to call into Advantage Health Plans. The beauty of the new phone number, it is a direct dial phone number into the Advantage Health Plans pod. So you do not go to an auto attendant, you do not go to an operator. When that call comes in, we already know that it's a banker on Advantage Health Plans, and it will always be at the correct team within Kimpton every time. So we're super excited about those changes. Lastly, call to action. First, we would love your rep. Again, Shannon, Jolie, Kanda, Merrick, Todd will be contacting you with your renewal as soon as it is available. We try to do many phone calls, just direct phone calls, even before the letters are out there in the mail. Second of all, we would love for you to schedule an employee meeting to come help, allow us to help you with your open enrollment process and where we can discuss changes, et cetera, and just refresh your employees on how to best use the plan to be able to get the best bang at the best buck out of the benefit plan. Also, we'll provide Advantage Health Plans with employee emails and phone numbers. We would also encourage our banks to assist in adopting a culture of consumerism and cost containment within your bank in regards to the health plan. As Vicki had mentioned, this is your plan. It's not Kempton's. It is not some insurance companies. You own all of the plan assets. And when we're able to keep costs low, we don't have to ask for additional contributions to the trust fund, or we don't have to ask for as much additional contribution to the trust fund. We can help you with that culture of consumerism. We will do that during an employee meeting. Also, Kempton Academy helps with that, but nothing beats a live person. Please share the educational materials that we will be sending you that are also available on the Advantage Health Plans web portal. Those materials are there to share with the employees. There is probably nothing that we send to the bank that is not able to be shared with every beneficiary, every member that is on the benefit plan. A brand new teller or the CEO, that material, they're all beneficiaries under the plan. It would really be up to the bank as to what you want to share, but we've heard feedback from banks, well, I didn't know that I could share that with the employees. Absolutely, share it with the employees if you feel that it is appropriate to share with the employees, but you're not going to cross some sort of a line there. And then lastly, promote and encourage KPP free utilization. Sound like a broken record on that, but again, it's big dollars, and it is an instant reward for the participants to be able to have that procedure done at no cost to them, plus save the bank money. Okay, we are at the end. I think I am a minute over, which, wow, I'm impressed. I went from 3 hours to 1 hour, and we only went an hour over. So thank you, Vicki and David, for helping us with that as well. We can stay on really for as long as we have follow-up questions, if there are any follow-up questions. I don't see any out there, but we'll sit here for a minute or two and see if anybody has questions. Of course, you can either ask the question here online or obviously submit a question via email, and either way we'll get your question answered. Reagan, I don't see any, and I don't see anything in the chat. Am I looking at that correctly?
Yes, you are. I'm not seeing any questions, so I think we are good for right now.
Well, we kept most of the audience the entire 60 minutes, so that's great. And since there are no questions, either I did a great job or everybody's asleep. But once you wake up, if you have questions, please submit those to us, and we'll go. Thank you all so much for your continued support of Advantage Health Plans Trust. And honestly, we are very honored to continue to serve you. We really enjoy our member banks, and there's a lot of you that we've known for a long, long time. And I just wanted to say thank you, and you make our careers more rich. So I hope to see each and every one of you, or as many as possible, at the upcoming banker conventions. And with that, we're going to sign off. Thank you, everyone.